minute, and then I'll hand it over. I'll do the brief welcome and hand it over to Lori. Can't hear
Nate,
the river in the background, Lori.
This is Christine from the coalition, Nate. Thanks for joining the Lunch and Learn, and thanks for the nice shout out, Lynda.
Yeah, no, thank you. I know Lynda and Art were there, and of course, yeah, you were presenting. So yeah, no, it was interesting. Yeah, to hear it from kind of the partner perspective, even the lender perspective. I thought that was yeah, the CDFIs are so unique, and there's a way to, I don't know, assist them in growing in so many ways too. I think especially for the alliance here, but everything else. So yeah, I'll be back. It's quarterly, right?
Well, it's monthly, but we have our housing conference the end of October, so the next one will be in November.
Okay, that's right. Yeah, and I can do that virtually, so I probably will climb on for that. Excellent. October is conference month. Okay, well, I will say if others join us, they'll hopefully, if they join us during Laura's moment here, they'll enjoy it as well, and then they'll hear the updates that we have following that. But I do want to say welcome again. Welcome on 7:30 every 2 weeks is a good ask, but I love it when I'm having the screen full of names here and it's filling up, and that is very encouraging as you're still on my listing tour executive director that I know you're all participating. So it's always, that's already my moment of gratitude. So thank you for being here. And I will mute myself and hand it off to Lori. Thank you.
Thank you, Nate. So nice to see you all, your faces, your names on this beautiful fall morning. We've entered a new season, and I imagine we're all feeling it, even in Las Vegas. It's just beautiful here, a little bit of changing of color and the harvest. Just a wonderful time of year. So I invite us this morning to get grounded, feet on the floor, sitting bones on your seat, and really feeling into the earth and feeling into the changes that this season brings. And taking a few generous breaths together. And if you can find a rhythm of your breath, perhaps counting to yourself, count of 5 on the inhale, pause. Count of 5 on the exhale, pause. Or whatever number or rhythm that suits you. So take a moment to feel into that rhythm of your breath. And imagining, feeling the rhythm of the earth's heartbeat under your feet. And for today, just appreciating your song, your rhythm, your heartbeat, your breath, the gentle movements of this body, and whatever song, whatever words might be coming up for you that are uniquely yours today on this beautiful morning. So with gratitude for our song, our rhythm, our expression, and bringing that together with the rhythms of those around us, our families, with those we're working with those we serve. And recognizing that truly there is one song. We all have a heartbeat. We all have expression together. So in our good work, with much gratitude, Taking another generous breath in. And maybe let it out with a little sigh. And looking at the mosaic, seeing who's here with gratitude. Thank you.
Thank you, Lori. Wow, and that. Whew. Yeah, hopefully we'll have some positive feedback from the programs here and everything. So on the agenda, I listed just the Nevada Financial Resiliency and Empowerment Project update. And again, this is what this is the brilliant idea of the couple minds here prior to even me arriving here, but and probably this advisory committee as well to better convey what Opportunity Alliance Nevada is doing, and we operate the project. One update is I'm beginning to get out tomorrow. Actually, I'm attending a community fair out in Fernley, which is a very safe environment for myself professionally, very supportive, and I will be presenting at their chamber breakfast. They have it weekly in a couple weeks here, as well. Again, safe area for myself to begin, testing, hopefully that the project itself becomes enough of a hook. So they ask, well, what does the project do? And we can dive into the various programs. Well, currently, we have the VFNs, we have the mediation that we'll hear about, and they do interface, which we'll maybe hear a little bit about, but and then the various pieces like with Lori, our announcement 2 weeks ago that we've unpaused the bridges training and everything as we come out of the COVID fog here and everything. So, but this is more of a solicitation to the advice to the committee, to each and every one of you who support us in a number of ways, whether it's resources, a partnership or funding or both or everything like that as well. We will be making some updates to the website. In fact, we'll probably be making updates between now and the next advisory committee as well. So it is, as that being the landing point for so many people in the 21st century, just how can we get the message out? I have had feedback where people, see what when they look at the services and they click on the tab and they see everything that comes out there as well. So, but we're looking for that too. And one of the kind of the pieces too is the interaction as well, is that, we're here to help all the time. Obviously the pandemic it's been its own thing, but most of coming out of it, I have a different view. I mean, I want to more or less have the population of Nevada ready for the next one, so to speak. So, it's not, we don't just need to be there to help. The Alliance is here, to strengthen everyone, regardless of timing, regardless of crisis and everything as well. So, please, we welcome your feedback. We welcome everything specifically from this committee, because that's why you exist, to advise us. So, that would be that. I'll repeat that solicitation at the end for you to contact us and just share anything that you see that you would like to see, or ideas, again, because there are so many other minds involved. But with that in mind, I am going to hand it back to Lori. Tracy, thank you for placing our summary for us to view as Lori updates us on the Volunteer Financial Navigator program, and then she'll hand it off to Shannon likewise, and the other navigators. So it is in your chat. It was in your email as well. And we can even, Lori, you could share it, or Lori or Tracy or I could share it if you want us to. So let's hear from one of the programs within the project. Thanks.
All right, thank you, Nate. So for our volunteer financial navigators now, what we're seeing in our calls, the tickets that are coming in, is, I would say, kind of a three-way split. We are still getting calls for rental assistance. And as you can see, if you've pulled up the data summary, the majority of all of our calls are coming from Southern Nevada, from Clark County, mainly, City of Las Vegas, Henderson. People are still applying for CHAP and are encouraged to apply for CHAP. Many have been served eviction notices, And again, we are advising to file an answer and ask for mediation. And so that's a portion of the tickets that are coming in. Others that are coming in, I would say, are desperate for housing, either currently living in their cars or soon to believe they will be living in their cars. And we, our navigators, are having a very difficult time helping them find even temporary housing. And we know that in Clark County, we need to get them into the coordinated entry queue in order to be considered for rapid rehousing there. In Northern Nevada, and maybe Brenda has some wisdom on this, for Washoe County, we are just kind of reaching a dead end for some folks to be able to find housing. So that is something we are really working together on with our navigators. And then the exciting news that I know you'll hear more about here shortly is we are getting referrals from the eviction mediation navigators to our VFNs. And those are, Shannon will tell you more about this, but folks who have been working through the mediation process and want to work with our navigators to really complete their spending and savings plan and move forward to resiliency and empowerment, to more stability. So we're very excited to begin working with those clients. That just started really happening the end of last week and this week. So thank you, Shannon, and your navigators. So we're getting calls, and those are pretty much the three areas that we are working with at this time. Just another plug, we are bringing on new navigators all the time, and still and always looking for bilingual volunteer financial navigators. So in your networks, if you know somebody or have any leads, please share our flyer or direct them to our website to become a volunteer financial navigator. So I think that's it, Nate. Thank you.
Thank you, Lori. Everyone should have this. I was sharing it there, but I'm going to go ahead and stop it so our next presenter can share what she may have. But thank you, Lori. Yeah, if you have any questions, just direct them our way too. I will be soliciting, again, I'll be asking for volunteers when I'm out tomorrow, and then after that, Tracy was able to update some collateral and everything, so we'll be out there handing it out and looking for volunteers, and both. I mean, ask for help or provide help, both sides. So if you know anyone, thank you. And I will ask, yes, Shannon, there you go.
There we go. All right.
Thank you.
Hope my screen is sharing.
I see it.
The right way. Okay, perfect. So the eviction mediation program is going very well. We're getting very settled and comfortable with doing our case intake work. And about 25% of our cases have, once we've told them about Opportunity Alliance and the Volunteer Financial Navigation Program, they have asked to be referred to that program. So I think that's a really good number, especially since we're just getting used to the process ourselves. So I think 25% moving forward into Opportunity Alliance is a really good number. We've started what I'm calling the mediation disposition analysis, and that is where we're taking the dispositions from the mediation that's already occurred, and perhaps they've already gone to hearing or they're en route to hearing, and we're taking about 12 data points from each of those forms and organizing them on a spreadsheet so that different things can be looked at, like if evictions have occurred before the court hearings, if CHAPS is settled before the hearing, and then even how the dates before when mediation happens compared to when the court hearing date is, and kind of the success rate of having CHAPS come through during that time, and preventing the evictions from going forward into the court hearings. So that's really exciting, and it's something that we just started this week, and it's been neat to see how all the data points make a lot of sense and what you can pull from 12 simple pieces of data from each mediation hearing. I did want to share what's on your screen right now, and this is a little feedback that our eviction mediation navigators have gotten just in this week, and I thought it was important to share. I'm going to read them in case you are. I'm going to read them in case you're on the phone and can't see your screen, but this is just a little taste of how we're helping out tenants. One is a huge sigh of relief. I just wanted to say thank you for all of your help. The next one, I talked with my case manager the other day. She received the information she needed from me, but she's still waiting to hear back from my landlord. I truly appreciate you checking in on me. The third one is, as always, I thank you. You're just an incredible individual who always responds, always helps, and is a very straightforward, honest person. I appreciate more than I could tell you in words. And then the last one, thank you from the bottom of my heart. You're really just an amazing person who cares about what they do, the people that come to you. I can tell you take your job very seriously and that you genuinely want to help people and inform and enlighten. You make a difference. I hope you know that. Thank you. And that's Yurindy and Hillary. They are our eviction mediation navigators, and they're doing really great work, and they know their purpose and they see how they fit into the bigger picture, and they're doing a really great job. And that's all I've got for now. So, thank you.
Thank you, Shannon. She shared those with me yesterday, and I said that you had to put that on a slide so everyone knows. As we know, anecdotes aren't data, so thanks for sharing some data points, Shannon. But testimonials do, they're the ones that tug at our heartstrings. So it's good to know that we're making a difference in there. This is, as our next presenter would say a lot of times, when she was in this position, we're here to fill the gaps, right? And it's wonderful to be a part of this program. Shannon and her team, I think they've just done an incredible job with something that, prior to this crisis really didn't exist. So she understands it. She's trained her team extremely well. And again, the interface with the other program, the volunteer financial navigators within the project and other pieces and everything has been stupendous. I love it. So, but our next presenter, obviously we have other things we do with the Alliance. We bring in partners, all of you included in that. And a new familiar face is Lynda. And she is now with Unite Us. And we have entered a partnership where we have a service agreement with them, the Alliance does. And this will be an opportunity for all of you to participate as well. And so I'm just going to hand it over to my predecessor, the unmatched Lynda Hascheff. So, and she can, I'll hand it right over.
Wow. Thank you, Nate. Thanks for that nice introduction. Thank you, Lori, Shannon, Tracy, all you rock stars that still run Opportunity Alliance Nevada. And I still hear the passion in your voice. You guys are amazing. As Nate said, I now work for a company called Unite Us, and we will be partnering with Opportunity Alliance Nevada going forward. As I talk about what we do at Unite Us, I'll probably really focus on Opportunity Alliance's Volunteer Financial Navigator program and their eviction mediation program, almost like a case study. We also work very closely, Unite Us, with Shannon Chambers, the Labor Commissioner, and Home Means Nevada has already joined this platform, this network. But Unite Us is we call ourselves a startup tech company. Anyone who works in the venture capital lanes, we are Series C, $160 million unicorn. We're acquiring other companies that make sense, other health data analytics, other companies that either have registries or access to, let's say, online pharmaceutical access. So we're growing in the space in a way that makes sense, in a way that is strategic and crafted so that we can serve our communities at the highest level. I think it's no secret that I worked for Opportunity Alliance for a long time, and it was a huge decision for me to leave Opportunity Alliance and migrate over to Unite Us. Before I go too deeply, I want to introduce you to my teammate, Barbara Hartzell. She joins us here today, and you'll be working with her a lot too. So she's my Senior Engagement Manager. If you want to say hello, Barbara.
Hi, everyone. As Lynda said, my name is Barbara. Great to be here and meet all of y'all.
Thanks, Barbara. So we're a statewide organization. Barbara and my other community engagement manager are located in Clark County, Southern Nevada, And we have a new community engagement manager coming on in Washoe County to join our team as well. But I really have been looking for this solution for over a decade. It is a technical platform, web-based, that is closed loop referral. When Lori's team on the VFN team start using this platform and they make a referral out, right now they mine 211 and do other really, use the really good solutions we have right now. They will know where this goes. They will know when it's picked up. They will know what the outcome of it is. They will know if these other organizations are actually accepting referrals. They will know exactly what the qualifications are, the thresholds, the paperwork that has to be uploaded at the same time. That's one component. The other component is it's a coordinated care network. That means it's person-centered and they get to tell their story once. The information follows them from resource to resource, and that there is hopefully less work on their part, especially folks like Lori mentioned. People are looking for housing. They have a lot of extreme stress on them, and to repeat their story a few times or to make sure they got every single detail down sometimes is a little bit trying for them as well. But this network is being built right now in Nevada. And no one knows their community better than you do. Shannon Myers and her group talking eviction mediation programming every day. Lori Martin and her group talking about these folks on every touch level. You've got Niani and Elvira and Carolyn and Brenda. They each know their individual ecosystem of their community much better than we do. But what we're going to do at Unite Us is talk to you. Talk to you about what does your ecosystem look like? What do your referrals look like? What do you need? What are the wraparound touches that you have, whether it's with your government partners or wherever? And we will work with you to develop what is a specific ecosystem to what you need within the parameters of this network. It is free to community-based organizations and nonprofits, due in part to one of our community partners that is what I call the payee side of our platform, which is Health Plan of Nevada and their Medicaid plan. There's a lot more that we could talk about on that side, but I want to focus on the community today and what you guys do. As far as funders go, and see lots of my good friends on here, Art and Pam and Jane and Deanna, I could go on and on. Really, this tool tracks the efficacy of funding in addition to other things. It can show us gaps in programs. It can show us redundancy in programs. We focus on all social determinants of health, and we, Barbara and I and our other teammate, Lusana, and shortly Irene coming on, we're going to look at it from the Nevada level. We're going to take our health equity dashboard and step back and go, why is it harder to get services in this zip code in North Las Vegas than it is in this zip code in Midtown Reno, as an example? So we are really excited about what it does for organizations. It builds capacity. It helps you do in a day, whatever your daily tasks are, centralized in an area. But what it helps us do in Nevada is step back and go, where can we make changes? Where are the pain points going forward? And whether it's housing, transportation, access to healthcare. As I mentioned, it's all social determinants of health. So right now, this network is set to launch November 9th. So we're talking to you. Elvira, I need to know what you need. How does your microcosm network function so that we can help get you to the, get your referrals, your coordinated care. Federally qualified health centers are free to the platform. So, I use the talk about the pricing a lot because community-based organizations, nonprofits are already stretched. They're stretched with the time that they have, with the probably not enough staff, in addition to taking maybe restricted funding and making it work. So mine and Barbara's goal, and Lusana's, is to talk to everybody in the community who are the experts. Health and social care is where the merge has to be. And healthcare happens in the community, in my humble opinion. Sick care happens in clinics and hospitals. So our goal is to bring in this solution, like I said, I've been looking for a decade, craft it to fit the highest and best use in Nevada on many different uses, many different levels. So with that, I think what I'll do, Nate, if you don't mind, can I share my screen, and I'll go through a few, I'm gonna go through a quick PowerPoint to give you an idea of what it looks like. We're not going to do demonstrations of the platform today because I really want to spend some extra time with you, the organizations, and talk about how does that look for Nevada Health Centers? How does that look for Brenda's organization on housing? How does that, so we need to talk to you individually and talk about the unique fit for you and how it interfaces globally in Nevada. So at the end, we'll give you, you can also connect back with Nate because as he said, he's our partner in this. Opportunity Alliance is going to help us spread the word, interface with you, and synergize it to the best use for our community. So with that, if you don't mind, Nate, I'm going to go ahead and share my screen.
Go right ahead.
We'll see how we do it this, folks. Usually my teammates, Barbara and Lusana, do this for me. But because I feel like I have close personal connections with all of you, I wanted to speak personally to you today. So let's give this a try. Let's see. Let me just open this first and then I will. Let's try this again. Share screen. Can everybody see my screen? Yeah, okay. Let me move this around so I can get it to start. There we go. Okay, so as I mentioned, we are here to build healthier communities together and bring coordinated care to Nevada. This organization, Unite Us, was formed by former military folks. Our founders, Taylor and Dan, came back from active duty military service and personally experienced the fragmentation between health and social care and the need to repeat stories and the need to provide some of the same information over and over and over. So they're brilliant. I mean, you could look up, I ask you all to go to the Unite Us website and look. We also have a Unite Nevada, but these young men who came back and decided to make a difference really are brilliant. So today we're going to talk about Unite Us, what the problem is that we think, our solution for it, how workflow works into this, security and compliance, and our next steps together. Sorry, my allergies are really, really bad today. So we want to talk about the new model of care that's driven by the community. Every one of you that are already doing the work in the community that we need to help synergize the siloed information that's there that can come together and make it work in a really cohesive, able to track functionality. So you'll see here that a lot of people, when they think of healthcare, they think of clinical services or hospitals. But as I mentioned, I personally think that healthcare happens in the community. And that's what this is going to do. We're going to have folks be able to connect within the community, whether it's churches, barbershops, actual programs that already exist. So here you can see before this type of solution was available, the processes, the conversations happened within four walls or virtually, really. But once it left your four walls, how did you know what happened? How did you track it? Opportunity Alliance came up with a great data tracking process that's very labor intensive. Somebody documents it in a sheet, then somebody translates that to a spreadsheet. Great system. But what this does is the amount of data that is offered on the backside of the use of this platform, especially for nonprofits, is exceptional. Had we had access to access to this Opportunity Alliance Nevada prior, there would be very little manual work. But so afterwards, organizations are equipped with tools that they need to collaborate across sectors, which they're doing anyway. So, we talked a lot about housing and how important this is. I mean, no one, the housing, transportation, it's all important and part of the ecosystem that is the entire support needs for an individual. So our screening tool allows partners to easily identify a client's needs and direct them to the best fit of the resources, whether it's shelter, housing assistance, or other community services. It also allows to send secure electronic referrals to provide to other organizations that provide a variety of services. And for us, this addresses the root causing of, let's say, housing instability before they worsen and stopping homelessness before it happens. This is what could be the use of this tool. It is the use of the tool. So what we say is that housing providers, and I focus this specifically because we know housing is one of the largest issues in Nevada. So I'm so sorry, my allergies are the worst. So once a client, let's say there's other entry points for housing, we know there's going to be other platforms that folks have to use, specifically HMIS. We're working on interoperability with a lot of these systems that we know exist in the state of Nevada that need to be meshed into what we do. We talked to CSA yesterday, the Community Service Agency, Leslie Colbreeze, and she already uses like 3 or 4 systems. And she said, this is fantastic. I am not asking my staff to add one more platform. I so understand that. So with that said, this will be a centralized coordination center and it drives outcomes. This is just an example of a Kentucky housing agency. So they received 1,040 assistance requests through 145 referrals, which created 58 internal cases. And when you schedule your one-on-ones with us to do the demo, this will be a lot more clear. But with that, so this is a housing agency. But because of the use of this network and where it can touch all the other folks in the community, they're doing the other good work. This agency was able to resolve 87% of the food needs, 72% of the utility needs, and 75% of the legal needs for the folks that stopped into their organization for housing assistance. Let's see if I can do this. So it really is much more than referrals. It's coordination. So with that, this is what the use of the platform can also offer to the agencies that use it. And I just want to make clear that the information entered into this network is owned by the organization that enters it. It is never shared unless you share it with someone on the platform. We use it at a high aggregated level to look at the health of Nevada in general and help impact and create pathways forward. There will also be, in the demonstration, you'll learn that there's consent forms built right from the very beginning to talk about how information is shared within the network. Privacy is very important. We'll get to that. But it helps save time and build capacity because a lot of what organizations are doing already can be done right here with the information digested and presented in a dashboard on the backside for their use. Most importantly, I think it enhances care. It's connecting clients to services outside the 4 walls and tracking the outcomes of that and knowing what happened to them. With that, we can use data and the insights to engage partners and find diversified revenue streams. It'll show us gaps, redundancies, potentially help us understand the barriers. So, you can read on this. I'm not going to read all of this out to you, but they were able to create things 14 days faster. The impact to client services improved by 78%. 89% more efficient community partner demonstrated efficiency to secure more funding. So because you're community-based organizations or even government organizations that can funnel through the grant process, this is why I think it's so important. And again, with the funders who attend these meetings, this could be a tool that you implement with folks that get your grants to say, use this free tool. It's going to help us track our outcomes a lot more efficiently. So with this, on the right-hand side of this, you'll see a little bit of what you'll find inside this network. But this really helps you. It's your story, so let's tell it. It demonstrates the organization's outcomes and helps us drive community change. In this, you can track your organizational activity, measure your impact through data, and inform community reinvestment decisions. And even if you're not involved in the community reinvestment decision component, it helps those that make the grants and decide where the money goes. It helps them understand where there's the best use of the money or where there was inefficiencies. So this is what we do. We are coordinated services that improve outcomes, and we are piloting a program right now, a payments component that is how community-based organizations are paid for their social care. Again, I'm scratching the surface on what we do. There's deep conversations on each component of this, but I truly believe it's a game changer for Nevada. Client privacy, it's our priority. We protect the information on this platform as if it were our own. We never share data, client data, without a consent. There's many ways for us to acquire this consent in over 50 languages. We protect clients the most sensitive information. If it's substance use or other sensitive information, there's overlays of who can see what in a platform, and we work with you to develop that. Client data is secure, period. Everybody is pretty much familiar with the word HIPAA, but there's a lot more of these acronyms and numbers that go with it. I am not the expert in that, but Unite Us has resident experts, resident subject matter experts in everything. I couldn't be more impressed with the folks that they have on staff to speak to all of this. So just really quick, if it's mental behavioral health, substance use, legal, the viewing permissions are much different. And we help you design that within your own organization. Meaning if a food pantry organization is sending the referral to a mental health service provider, the outcomes and the notices are much different than if it was from food pantry to food pantry. It's much more visual for those type of referrals. We're very careful with the sensitive types of services. So here's a list of a lot of acronyms and numbers that might mean something to you. They are really important. And our infrastructure is gold standard. So anyone that's worried about data privacy, personal information privacy, we've got you covered, but don't take our word for it. I'll get the experts in front of you to discuss it. So these are showing you what we're doing in Nevada. We will go live, hit the button so people can send and receive referrals in both Clark and Washoe in November. And then we will work into our rural components in 2022. However, I will tell you, we have had robust discussions with Deb Lush-Griffin in the Nevada Rural Health Network, and they're as engaged as anybody. This is where I think platforms, solutions, networks like this play so heavily. I think their importance and efficacy go up once you get into areas that are not probably as well served as they could be. You'll see some of our partners on the side nationally, people we work with. We have a few folks already who've signed up. It's called a partner referral form that we'll talk to you guys about in your one-on-ones. Obligates you to nothing. There is no cost. What it does is get you into an ecosystem where you can send and receive referrals, know what happened to them, track the outcomes, know what the program requirements are before you get there. Are they receiving? Still open? Are they not? So with that, I just want to let you know that here's a snapshot of our team. I'm Lynda, the Nevada State Network Director. Barbara's my Senior Community Engagement Manager, and Lusana couldn't join us today, but she's my Community Engagement Manager. And we're passionate. I hope you can hear that. We know Nevada. We've worked here a really long time. I've worked in advocacy. I had the honor and the privilege of working with the folks at Opportunity Alliance Nevada, and I'm still humbled by the amount of passion they bring to their work every day. This is a game changer for helping them continue to do that. So with that, I am going to stop sharing, and I would like to open it up for any kinds of questions. That was a lot of information really quick. Anybody with questions? So, okay. So if you have a question, just jump in. But in the meantime, like I said, we are partnering with Opportunity Alliance Nevada. They're going to help us hold more forums. They're going to work with you on understanding this a little bit better. What I'm going to do is I'll put my email in the chat, and feel free to reach out to me. Visit our websites and let's talk some more. Just to give you an idea, we are working on a pilot program with Reno Housing Authority. I kind of handpicked the folks that I think are key important stakeholders to make this ecosystem work well. Hope Link of Southern Nevada we're working with. There's many more, but just to give you an idea of the folks that we're reaching out to: Home Means Nevada, Opportunity Alliance. So I'm super excited. This tool is super easy too, by the way. The technology is very extensive, but the user component is really easy. If anyone's interested, we could go into a quick demo, but I wanted to be really respectful of your time and what you guys do in a day, and already have a lot on your plates. So I really do hope that Elvira and Brenda and Carolyn and all of you, that we hear from you so that we can give you a one-on-one personal review and demo of what this is. Lori and Shannon, I cannot wait to show you this tool. It's going to be a game changer. So with that, I thank you for your time and thank you for listening. Just scratch the surface with this, lots of information to share. And most importantly, thank you for what you do for Nevada and doing your community. And we look forward to making this network work for you.
I thank you too, Lynda. I think that was quite a bit of information. Obviously, we, as I stated, Opportunity Alliance Nevada we just entered a formal agreement with Unite Us. We are what's called a convener, which is simply, we're going to combine our resources. One statewide organization helping to grow another one, which the takeaway should be, this is robust. This will help, every single Nevadan on some level, just allowing all the partners. And I think it was the perfect fit. I mean, you got some of the backstory as to why Lynda, left. I think for the opportunity to follow her, but we are the alliance. We are the table, as she and so many of you would say over and over as well. As I was speaking with Lori last night too, as Lynda said and Lori says, we build bridges over the gap. Well, there's a lot of planks that can come together for Unite Us for those bridges, and that's fantastic. So to fill more gaps and and again, help every Nevadan. That's part of all of our goals too. Certainly with the alliance, with everything you all bring to the table. These are services that we are trying to offer to Nevadans. And as I said, that's one of the pieces on my listening tour. And as it grows now in person, as Lynda said too, with my safe partners, it's one of those things too, when they ask, when people, the connotation that they have to be in crisis for our VFNs to work with them. And it's like, no, you need to know where you are, your finances are, to be ready for the next event, for the next crisis or whatever. Again, all of you are partners in that. I'll leave it a little open, any open discussion, any comments, questions you had that for Lori or Shannon or Lynda likewise, or myself in the last few minutes here. Feel free to unmute and speak up if you have anything else, anything's come to mind in the time we've been together. If not, you do have contact information for all of us. Feel free, as something pops into your head, as Lynda said, reach out to her, reach out to me, reach out to Shannon or Lori if you had anything specific to the programs they presented on, or Tracy and myself. We can certainly forward anything along. I want to thank you, as Lynda said too, thank you for your time. Again, 7:30 every other Friday. It is quite a commitment. I can say this much as many of these done. There are a handful of you. I have seen everyone, so I truly appreciate that. It is your time. We will have the regular scheduled one in 2 weeks. And again, any ideas you have as far as for the Alliance to promote the project, any questions you might have, I would appreciate that. My ears are always open. My listening tour is more of a lifelong thing than just an immediate thing too. So yeah, please share any ideas, share any resources. Feel free to reach out to Lynda specifically, but as a convener, we are going to become more and more educated on platform and everything as well. It's going to be a very nice natural partnership, again, to grow both of our presences, all of our presences, all your organizations as well, to do what all of us do and use the Alliance as the table. So if there's nothing else, I will say again, thank you to those of you who attended. Thank you for your time, and we'll see some of you in between now and then. And if we don't, we'll see you in 2 weeks, 7:30 on a Friday. Thank you.
And thank you everybody for your time.
Thank you, Lynda. So
Thank
good to see you.
you.
Thank you.
Bye, you guys.
Bye.
Thank you all.